Hello everyone, Dr. Michelle Dupuy from New Life Integrative Health Center, and I just want to thank you for wanting to watch this presentation on cardiometabolic syndrome. So you may want this to watch this presentation because you either have heart disease or diabetes. You may want it for a loved one. You want more information. It doesn't matter. That's exactly why I do these is so that people can get more information to help themselves. And when you're done with this presentation here today, you're actually going to have some action steps that you can use to improve your health, okay? And if you're wondering why I do these talks, it's because I want to improve the health and lives of people. And I believe our current healthcare system is not managing our health, but managing disease. So basically what I'm saying is we have a disease management system, not a true healthcare system. And we need to change this, but the only way to change this is that we have to be the change. All right. So I always start these presentations with the trailer of a documentary. And so what I'd like you to do is just stop the video here, go onto YouTube and watch The Processed People, the documentary trailer. So it's about 3 minutes long. So I suggest that you do that, then come on back into the presentation. All right. So go ahead and do that. All right. So they make some pretty good points on there. Like our consumption of food is out of control and that we've been lied to, especially about food. We're moving less and eating more. We're overfed and undernourished. I mean, think about that one. So here we are. We're eating more, gaining weight, but when we do blood work, we're seeing that we have nutrient deficiencies. I mean, we're deficient in magnesium, we're deficient in calcium. Think about that. That's pretty crazy when we begin to look at that. Our medical system is selling sickness. There's an explosion of chronic diseases, and you're not healthy just because we don't have pain, which is very important because lots of times we use that pain as an indicator for our overall health. Not a good indicator. And finally, they said, it's up to you. Health is your choice, which is very true. All right. So we have a choice on how our health is. Okay. So would you agree with all of those? So here's some more questions. How many of you agree that we currently have a healthcare crisis in our country? Yeah, but I mean, not just in our country, but even worldwide, if we're to consider that. I mean, and we do. How many of you here have a health condition yourself? Like if you're watching today, like I said, do you have cardiometabolic syndrome? Do you have diabetes? Do you have heart disease? So do you have a condition? And if you do you know what the root cause of your condition is? All right. So, and we'll get to the importance of knowing that. Okay. So this is going to be a really good presentation for you. You're going to get some valuable information that at the end, you're going to have to do something with. You're either going to have to take action on it or it's going to be of no value to you. All right. So you may be asking, what type of doctor am I? Well, I'm a proactive doctor. And what I mean by that is I don't sit behind my desk and wait for sick people to come to me. I actually get out there and I do these presentations and, I tell the truth. And I would assume that the majority of people would want more than just information, that they'd actually want some guidance and help. So would that be a good assumption? And knowledge is good, right? But sooner or later, you're going to have to act on the knowledge or nothing's going to happen. So we could say that the most powerful thing is actually acting on the knowledge. And this is how I get the results that I get in my clinic is, I go out there and I find these top doctors that are, doing presentations or providing courses, and I take their course and I learn from them. And then I come back here and I put the information into easy use programs that people can use. So it's about taking the information, put it into a usable form, and then going out there and being able to use that. So you're going to have to do the same thing today. I'm going to be giving you some great information, and then you're going to have all this knowledge. But in order for it to work, you're actually going to have to take action on that knowledge. So does that make sense to you? I hope it does. Okay, and we could agree that most people kind of know that they should be making healthier choices, right? So why aren't they? I mean, because most of them don't have a system in place. And 94% of all failures are because we don't have systems in place. So why then do we have an epidemic of sick, fat, and depressed people? And this isn't my opinion. This is actually a fact, right? So you just have to look around and look at the studies. And once again, the reason that we have this is because most people don't have the knowledge or the action steps to prevent this from happening. And that's what I want to change. I want to give you the action steps, okay? And that's why I take pleasure in doing these talks, is so that I can go out there and teach people and offer an opportunity for people to begin to take care of themselves. So let me give you a little bit more background information about myself and what gives me the right to talk to you guys. So you may or may not know I am a doctor of chiropractic and a functional medicine physician. I have many degrees in functional medicine and in functional movement. So basically, I also have a master's of science in human nutrition functional medicine. And I've actually spent the last 19 years of my career studying and applying anything that has to do with improving function and restoring health. And along this journey, I've learned many different things. And one of these things is I know I'm not the right type of doctor for somebody to come in and just ask me, hey, doc, tell me what to do, or can't just fix me. This approach has nothing to do with health, and it will not restore your health. And this approach will only manage disease, and I'm trying to change that. So it's the same thing as if you look in traditional Chinese medicine, a doctor that manages disease is considered a poor doctor, and a doctor that prevents disease is considered a superior doctor. So what type of doctor do you want to see? A poor doctor who's going to manage your disease, or a superior doctor who's actually going to try to prevent disease, right? So that's why I've chosen the functional medicine practice and the functional medicine model. That's where we get to the root cause of your health issues and not just treat the disease. This is different than in conventional medicine where they just treat or manage the disease. So for example, let's say you're fatigued. You don't want to see anybody. You never want to leave the house. You're tired of living. So what do you think that you'd be diagnosed with? Likely depression, right? So if you went to the medical doctor, what would they give you? An antidepressant, right? But in functional medicine, we would ask more questions. We would ask questions like, have you recently had a loss? Have you had any sort of childhood traumas? Has your diet been terrible? And now you're taking antacid medications that could be causing a B12 deficiency. And so it's the B12 deficiency that's causing the depression. Or are you eating a lot of gluten, and now that gluten is actually beginning to affect your thyroid, so you're developing Hashimoto's thyroiditis, and the Hashimoto's thyroiditis is actually causing the depression. Or you live in some place where there's not a whole lot of sun, and you have a vitamin D deficiency, and that's causing a depression. So can you see that in functional medicine, we begin to work once we have a diagnosis. We begin to look for the cause. Whereas in conventional medicine, once they come up with the name for the disease, they actually stop thinking. You're going to get a pill and the job's done. It's a one-size-fits-all. And think about it. You know what? You could have depression. Your neighbor could have depression. Somebody down the street could have depression. You could have a sister or brother that have depression, all due to a different cause. But you'd all get the same medication. How does that make sense? It doesn't make any sense, right? So in functional medicine, what we do is we begin to look for the cause, and then we personalize the treatment, right? So does that make sense? So just because you know the name of the disease, it doesn't mean you know what's wrong with you. And so we'll talk a little bit about cardiometabolic syndrome. So it's the number one driver for chronic diseases. And this is why I do these talks and put together the systems at work, so that people can learn that there are different causes to their disease and that they can be reversed, right? So there's 3 stages to disease. There's silent, reactive, and disease. So I just want to go over those just for a sec here. So silent. And so basically you can't see it on blood work, you can't see it on x-ray, and when it first starts, you can't really even see it microscopically, but something has triggered the start of a disease. Right? So this process can last for days, weeks, months, or even years. There is absolutely no pain here. And if left untreated, which it usually is, it's going to progress into the next stage, which is reactive. And that's where you can start to begin to see some changes. So like, for example, in this one here, you can actually see the person has lost their curve. So they have no curve here. So that means they've lost function. Okay, and you can actually begin to see a little bit of vacuum phenomena. I'm not sure if you can see that, but you can actually see that right there, which means that degenerative disc disease is starting. They might have some pain, but not very likely they do. Now, this stage will also last for months, years, and if nothing changes, like there's nothing here to restore the function to the spine in this case, this is going to progress into the next stage, called disease stage. Okay, so this stage you can actually start to begin to see some changes. So you can see down here they have degenerative disc disease. So they have some bone spurring occurring right down in here. So if you're you might have some pain, you may not. Let's say you had pain and you go to your doctor, and the doctor would put you on what? Probably put you on a painkiller or an anti-inflammatory. So let me ask you, Is that going to correct the problem? If he put, there's no way an anti-inflammatory is going to correct this. You don't have this because you have a deficiency in an anti-inflammatory or a pain medication. Okay. Now, the thing too is, if you went and you asked your medical doctor, so why do I have this? What do you think he's going to say? Well, you're not getting any younger. It's just a part of normal aging process. Well, I always ask the question, up here, these vertebrae look, pretty healthy. The discs are okay. Are they the same age? Well, of course they are, right? So then how can it be an aging process? This is not an aging process. This is a loss of function over time. Okay, so do you see what I'm talking about? Now, if I go back and here, and we said this is heart disease, and we had, starting of plaquing. So the very beginning, you're not going to see anything, but the process that creates the whole plaquing environment started. Something triggered it. It was a loss of function, whether it's a loss of function to the artery itself or whatever. So there's a loss of function, and it begins to form a plaque. Now, you could go for years and years and years, and all of a sudden, you're going to have a little bit more plaque, and it'd be in more of an reactive stage where you could have 50%, 75%, and you may not have any signs and symptoms yet. But if they were to look, we'd see it, even though you don't have any signs and symptoms. Now, if that was left untreated, it would develop into all of a sudden you have a disease where you have 99% blockage, and you're starting to get low on oxygen. Maybe you're getting some chest pain, that kind of stuff. So there would be where they would do an intervention. But wouldn't it be better if we did it in the earlier stages, if we knew, right? We just started to take care of ourselves a lot better. So that's kind of what we're talking about here. 3 stages of disease: silent, reactive, and disease. Okay, so remember those. So why do you think we have a health crisis, right? Too much food, too little exercise, stress, meds. So who's taking medication? Are you taking medication, or do you know of anybody that is taking medication? So if you're the one who's taking medication, let me ask you, do you think the medication will change your health? I mean, let's think about it. Can you medicate your way into health? No, but you can medicate your way into a health problem, right? So if drugs won't make you healthy, what will? Diet and exercise, right? Okay. So did you know that we rank 30th in healthcare? Right? So we're right down here, 30th. Okay? So this is an older study, so I'm not sure exactly where we are this right at this moment, but we rank 30th at this time, and we're probably not a whole lot better. So we spend more than most countries on healthcare, right? So as we advance in our healthcare, we actually become sicker. I mean, think about it. Do we have more cancer, more heart disease, more diabetes, more stroke? Yeah, we do. So what's the point of advancing a broken system? I mean, there's a place for the medical system, and that's called acute care or emergency care. But if you have a chronic degenerative disease, this is the worst place that you can be. And today, 80 to 85% of diseases are chronic degenerative diseases, as you'll see, is lifestyle related. So this acute emergency care system is not really going to be able to help you a whole lot. All right, it might be able to manage it, but it's not going to be able to change your health. Okay. So here's some stats. 45% of adults have at least one chronic disease. 1 in 4 adults have multiple chronic diseases. Chronic disease is responsible for 7 of 10 deaths. Chronic disease accounts for 86% of healthcare costs. 85% of all medical procedures and surgeries are unproven. That's from the British Medical Journal. Other countries won't buy our medications. They say they're overpriced and they kill people. The BBC says only 7% of our major chronic healthcare treatments are effective. So chemo, radiation, not working. Yet they cost upwards of $100,000, and we're still being asked to fund this. And globally, 50 million deaths every year from non-communicable diseases. Okay, so that means that they're not infectious diseases anymore, or acute diseases. Okay, so these are non-communicable. So 47 trillion will be spent over the next 20 years. 2 trillion in lost productivity every year. So this is the single biggest threat to global development. Okay, this is actually the GDP for the 6 largest nations in the world combined. Okay, so we can say that 86% of our healthcare dollars are being spent on chronic diseases that are preventable and lifestyle related. The problem is we live in a medical model that excels in acute emergency care. But if you have a chronic degenerative disease or condition, this is the worst place that you can be. So, and we're really missing the point. We're in a new era where we don't have as much acute infectious diseases anymore. So today we have more social diseases like diabetes, heart disease, and obesity. Okay. Now these chronic degenerative diseases are driven by the environment we live in. So it's based from the choices that we make. They are either healthy choices or unhealthy choices. Okay, this needs to change. We need to be putting our energy into things that work, like changing our lifestyle, our environment that surrounds us. Okay, so let's take a look at the 5 factors or environmental factors that affect us today. And there's a lot more, but I'd be here all day talking about those. Okay, so one of the first things we need to look at is junk food or the wrong food. Okay, so food is information to your body. The food that you're eating is either hurting you or healing you. So what do you think that your food is doing to your body? Is it hurting you or healing you? Okay, certain foods can increase inflammation in your body. So like gluten, processed foods, and trans fats. So they all have an effect. Our genetics hasn't really changed much in many years, but what has changed is our environment. Our evolutionary pattern of eating was more plant-based, and today we're actually eating more processed foods. Our ancestors ate about 22 teaspoons of sugar per year, and now we're consuming that in one day. So we consume about 150 pounds of sugar per year, and we consume about 146 pounds of flour per year. So this is about 1 pound of combined flour and sugar for every man, woman, and child on earth today. So this is actually considered a pharmacological dose of non-nutrient-like substances. So that means they have no nutritional value. Okay, these substances will also drive up your insulin, which we're going to show you is not going to be necessarily a good thing. So insulin is the driver for so many of the chronic diseases that are burdening our healthcare system today. So you can see here that the health conditions that are associated with insulin resistance. So just look at this chart over here. So you got pulmonary disease, non-alcohol fatty liver disease, which is at epidemic proportions. And I see this in so many people. Gallbladder disease, gynecological problems. So like infertility, polycystic ovarian syndrome, abnormal menses, osteoarthritis, skin conditions, gout, inflammation of the veins, cancer, pancreatitis, hypertension, high cholesterol, diabetes, coronary heart disease, cataracts, and stroke. So you can see that one condition, hyperinsulinemia or high insulin, can lead to so many diseases. And the fourth environmental issue is a sedentary lifestyle. So a sedentary lifestyle is created by our modern day inconvenience. So we can because we no longer have to go out and get our food or our water. We just go to the fridge and the tap, right? We no longer have to chop wood to heat our homes. We just turn up the thermostat. And our jobs are not as laborious as they once were. So we're doing a lot more sitting than what we used to. And now we actually have to begin to add things to our already current busy lifestyle, like exercise, just to keep healthy, okay? And with the sedentary lifestyle, you're going to have less mitochondria, which means less ability to produce energy. So if you don't exercise, you're going to actually lose these mitochondria. So these are the powerhouses of the cell. So these are inside your cell. You have a cell here, and inside your cell, you actually have this little wee organelle that is called the mitochondria, and that's what produces the energy that makes you move and gives you the energy, okay? So it's what actually converts the energy that's stored in food into energy for you to live and function. So just that I don't lose you here, these mitochondria are in all cells except for red blood cells. So you're going to find these in muscle cells and fat cells, as you're going to see. I'll show you that in a little bit. Brain cells, kidney cells, and heart cells, all right? So with decreased activity, okay, so in sedentary lifestyle, you'll have decreased activity of GLUT4 transporter receptors. And don't get confused, because I'll show you a picture of all this, right? So I don't want to lose you here. So these are found on muscle cells, and they're also found on fat cells. So with decreased activity, so the sedentary lifestyle, you're going to have decreased activity of the GLUT4 cells on the muscle cell, but increased activity on the fat cell, which you're going to see is not going to be good. So you're going to decrease the amount of energy that the muscle cell was going to get, and you're going to increase the amount of energy the sugar going into the fat cell. Not a good combination. Okay, so we'll show you that in the next couple of slides. All right. So here I just want to show you this study that shows that the amount of time that you're inactive it is tied to higher death rates, and that by getting up and moving, that can help. So if we just look at this bold here, right here. So adults who spend much of their time sitting have increased mortality risk. So we're going to die. And the risk is even higher when sedentary time is uninterrupted, according to a prospective study in the Annals of Internal Medicine. So like I said, once again, the biggest thing here is that if you're sedentary, you have an increased risk for dying. And if you have uninterrupted sedentary moments, that's really going to have an effect too. So basically what they're saying is that you should get up and move every 30 minutes. And that's going to protect against the health risks incurred by being sedentary. All right. So when you take everything into account, that what we've just talked about, okay, so the sedentary lifestyle, all of that kind of stuff, and how it affects the mitochondria, this is what I'm talking about. So if you have something that's going to affect those GLUT4 receptors, if you look up here, you can see on the cell. So this is a cell. You have a GLUT4 receptor right here, and these, like I said, are on your muscle cells, your brain, your heart cells, your kidney, all those things. So if something affects this on a muscle cell, okay, then you're not going to allow the glucose or the blood sugar to enter into the cell to actually come down and go into the mitochondria right down here. So your mitochondria. And it's going to affect that. So if something affects that receptor, like inactivity, then it's going to also affect the mitochondria. Then also we said that a sedentary lifestyle affects your mitochondria. So this down here, so you can't make energy. Okay, so you're going to have a decrease in the production of ATP, which is not going to be good. So you're not going to have the energy for bodily functions. So you're not going to have the energy to make hormones. You're not going to have the energy to digest food. You're not going to have the energy to actually lose fat or break fat down. You're not going to have the energy to remove toxins. So this is not good. All right. So a lot of things can affect that. Yeah. And in this slide here, I just want to show you the effects of nutrient deficiency, because we said that we're overfed and undernourished, right? You remember that? So we're getting a lot of calories, but we're not getting a lot of nutrients. And so that's what I just want to show you, how it affects the energy pathways. And we wonder why we have an epidemics of chronic fatigue. Well, this is one of the reasons why. So up here in the yellow, this top part here, basically what I'm showing you here is the energy pathway that we talked about. And if I go back here, this is the same deal right here, this energy pathway. Well, this is the same pathway. What I want you to see is the nutrients that are required in here. So you need magnesium, you need folic acid, you need B1, B12, phosphorus, zinc, chromium, and once again it says magnesium, and B3, niacin. You need those just in this one pathway, okay? So if we go back here, just in this one pathway, we need all those nutrients that we just talked about. All right. Then if we go over here into what's called the Krebs cycle, so we see over here we need B vitamins, B1, B2, B3, B5, lipoic acid, L-carnitine to help with fatty acids. We need iron, we need B3, we need a bunch of amino acids, B1, 2, 3, 5, lipoic acid again. So we need all of those in this pathway. All right. So if we look over here, that pathway is right here. Okay, so that's in the mitochondria itself. Now, if we look at the bottom here, this is called your electron transport chain. Don't worry about the names. I only want you to understand that if you have nutrient deficiencies, it's going to affect your energy. So I hope that's what you're kind of getting. So here we have where you can see down in here, and this is in the mitochondria here, down right in this area. So this here we see we need B3, we need B2, we need some CoQ10, vitamin K, we need some iron, we're going to need oxygen too, so all of that. So my point here, if you have a nutrient deficiency and you're slightly anemic, you are going to have a problem with energy, making energy. And I see this all the time. So I see nutrient deficiencies and that are leading to people that are slightly anemic, excuse me, and this is going to affect your health in the long run. And it's eventually going to progress into a chronic degenerative disease. And it reminds me of this picture of a person that is starting off on a ship. They're sailing and they're 1 degree off. So by the time that they get to their destination, they're miles and miles off. This is going to be the same thing. If you start, in your 20s with a slight anemia, by the time you're 20 years down the road, you're 40, you're 50, you're going to have a multitude of diseases because these deficiencies here have affected your mitochondria, that is going to lead to a lot of chronic degenerative diseases. Okay, so really, really important to understand that. The fifth environmental issue that we talk about is toxins. Now, toxins are all over, and they're going to create so many imbalances in your body, such as hormonal imbalances. They're going to affect and cause insulin resistance. It's going to lead to inflammation and obesity. I mean, toxins can actually make you fatter because your body doesn't want to have these toxins floating around in there, right? Because they're going to cause a lot of damage. So what it does is that it puts these toxins into your fat. So your fat actually becomes a storage for these toxins, which is very dangerous. If you begin to lose fat, these toxins get excreted again. And these toxins will also keep you fat because as you release it, let's say you're losing weight, you release these toxins are going to be accumulating and saturating your body. And what then is going to happen is the body is going to create a system to store these fats back down there. So you actually won't be able to lose these fat. It'll shut off the fat burning process. So that's pretty important. And toxins will affect your energy production pathways like the ones we talked about in the mitochondria, especially in the electron transport chain, which I'll show you in the next slide here, right here. So here's that electron transport chain. So if you look up here, you see these names you don't understand. Those are insecticides, fungicides, pesticides. And what they do is they actually begin to affect the start of the electron transport chain, which is going to mean that at the end, you're not going to have any ATP, no energy. Okay, so this is pretty serious stuff. So when people ask me, hey doc, how long should I be doing a detox? I always say, as long as you're retoxing, you should be detoxing. Okay, so what that means, if you're eating and breathing, you need to be on a detox because we're constantly getting bombarded with toxins. Okay, so here's another study. Here's a study that shows how pesticides and herbicides can affect your thyroid, and which will then create metabolic dysfunctions. So down here in the bold here, pesticides and herbicides disrupt thyroid function by interfering with thyroid hormone gene expression. So inhibiting the thyroid's uptake of iodine, binding to thyroid hormone transport proteins, reducing cellular uptake of thyroid hormones, and increasing thyroid hormone clearance from the body. So we know that pesticides and herbicides are going to cause hypothyroid issues. Here's another study showing that toxins in your common household toxins can harm the thyroid. So basically, when we're looking at things like, down here, items such as computer and TV screens, furniture, carpet padding, synthetic textiles, flame retardants, all of these things are going to have an effect on your thyroid. So flame retardants disrupt thyroid function by mimicking or looking like the structure of thyroid hormone. So they're going to displace the T4 from thyroid hormone binding proteins. It's going to prevent T4 from being transported in the blood. They're also going to compete with T4 for thyroid hormone receptor binding sites and disrupt estrogen activity. And so this is going to have a huge effect on postmenopausal women that are exposed to a lot of these toxins, okay? So what I hope you're getting so far is that there's many different factors that can cause one condition. So like hyperinsulinemia and toxins, right? So we've seen those that could be affecting it. So are you kind of getting that, right? So my job really begins once we come up with a name, whereas in conventional medicine, they're done because they give you a pill, right? And I'm not, once again, in any way putting down the medical profession. It's just that they don't have training in things that get to the root cause of disease. So hopefully you can see the difference between conventional medicine and functional medicine. So let's talk about cardiometabolic syndrome a little more. So cardiometabolic syndrome is the risk factor for developing type 2 diabetes and cardiovascular disease. It's due to the cluster of preventable risk factors, which is very serious. So these risk factors are things like smoking, high HDLs, hypertension, elevated blood glucose, abdominal obesity, especially visceral adipose tissue, which we're going to go into quite a bit here, insulin resistance, low HDLs, so those are the good cholesterols, and the LDLs are the bad cholesterols, high triglycerides, and inflammatory markers. Now, I look at a lot of blood work, and I can honestly tell you that the majority of the people that I see have these risk factors. And this is, again, is why I'm doing this talk, because it's serious. And it's also preventable, and that's we can actually begin to reverse chronic diseases. And I really think people need to know this, because oftentimes they don't think that they have another choice. Well, you do have another choice, okay? You just have to go to the right doctor. So we could say that the causes of cardiometabolic disease, or really any chronic degenerative disease, is your genetics plus your environment, your surroundings, the foods you eat and all that, and your lifestyle is going to equal your disease, okay? So here's a few more stats. Every 34 seconds, someone has a heart attack. Every minute, someone dies of a heart attack. And let me ask you, what are you told is the cause of heart disease? Cholesterol, right? So the problem with treating heart disease is it's oversimplified, because we're told that heart disease is due to high cholesterol. But from what you've learned tonight or today, do you think that there could be another cause for heart disease? Well, yeah, right? I mean, cholesterol is not the culprit. In this study of 136,905 patients hospitalized with heart disease, more than 75% had normal cholesterol levels. That's what this is showing, right? Normal cholesterol levels. So we know that cholesterol is not the culprit. In the Jupiter study, it showed that if they only reduced the LDL cholesterol, there was no benefit to the patient. However, if they reduced the LDL and the C-reactive protein, there was a benefit. So the variable was inflammation. And we know that inflammation is one of the major causes of heart disease. And we know that there are many things that will cause inflammation in our bodies. So if we reduce the things that cause the inflammation, we're going to reduce our risk for heart disease. And here you can see that the early progression of atherosclerosis, okay, starts in your 20s. Look up at the top there, right? So it starts in your early 20s where you can see the oxidized LDL, right up here. And you can also see that when it progresses, it actually begins to develop secondary conditions such as high blood pressure, right? So as it progresses, it's developing this high blood pressure, okay? So you can also see at the top, beside the oxidized LDL, right up here, how they have macrophage inflammation, so basically inflammation, that begins the process of plaquing. And then at the bottom, you can see the things that you need to treat this, like increase your HDL. So make sure that you have an appropriate number of the good cholesterol. Decrease your oxidation and inflammation and all of that kind of stuff, right? So in this slide, what I'm showing is that the clinical consequence of metabolic syndrome. So what that means is if you have metabolic syndrome, you can develop these symptoms, like insulin resistance, inflammation, osteoporosis, oxidative stress, central obesity, endothelial dysfunction. So that's an dysfunction inside of your blood vessels. Polycystic ovarian syndrome, non-alcohol fatty liver disease, small dense LDL. So those are the really bad LDLs. Hypertension, low HDL, so low good cholesterol, increased triglycerides, and glucose intolerance. Now, I call these symptoms because they're caused by something. So like insulin resistance is caused by something like toxins, harmful hormonal imbalances, heavy metals, those type of things. So how do you know if you have cardiometabolic syndrome? Well, you're supposed to have 3 of the 5 following diagnostic criteria over here. So waist circumference of over 102 centimeters for males and over 85 centimeters for females. Triglycerides have to be of a certain number. This is the American numbers. HDL, low HDL, high blood pressure over 130, 130 over 85, and glucose over probably about a 6. Okay, so the problem with this is the diagnostic criteria is too strict, right? And the diagnosis is not a cause. It's they're only risk factors. These are just risk factors. And once again, we run into the problem of waiting until we have a disease to make the diagnosis. So we can see things earlier through proper testing. Right? Does that make sense to you? So why would we want to wait until we have three of the following to get a diagnosis? When we can begin to see things changing way before we have a disease, right? So we have silent, we have reactive, and then we have disease. So you see what I'm saying here? Okay. So prevention is the key, right? I mean, when should you start treating a disease? Well, before you get it, right? And I hope that's what you're seeing and you're learning is it's to prevent this stuff, right? So in functional medicine, we begin to look upstream for the cause. This is the only way to resolve any sort of condition. And if we can affect the upstream cause, we can change the downstream diseases. And here are some upstream causes for cardiometabolic syndrome. So like diet, meds, stress, toxins, inflammatory process, gut health, visceral fat, hormonal imbalances, genetics, so those things, right? So let's take a look at a few of these, okay? So diet. Foods have different effects on your metabolism. All calories are not equal. I want you to think of 750 calories of broccoli versus 750 calories of pop. So 750 calories of broccoli is going to be 21 cups. Half a teaspoon of sugar, 35 grams of fiber. Good luck eating that, right? So 750 grams of pop are going to be 46 grams or teaspoons of sugar. They're going to be no fiber and affects the body very differently. It's going to increase your insulin. It's going to increase your triglycerides. It's going to decrease your your good cholesterol, your HDLs. It's going to increase inflammation and increase visceral fat. Okay. So if your diet could also contain food sensitivities that would cause inflammation. And food is not just calories. It's information that's either going to heal you or hurt you, right? So food can be the most powerful medicine or the most powerful poison. Medications. In some of the studies using drugs to help with diabetes, like these oral hypoglycemic drugs, the outcome was death. I mean, all you have to do is look at the black box warning on these things, right? So did you know that the number one cause of death for diabetes is actually heart attacks? So why are we giving a medication that could speed up the process, right? So the medication, these medications can actually cause heart disease. So why do we want to do that? There is a better way, right? So these drugs work by driving up insulin levels, and this is not good because when you increase your insulin, you're also increasing inflammation and oxidative stress, resulting in less energy production and, of course, chronic degenerative diseases such as heart disease, cancer, and diabetes. Toxins. So there's more and more data that's showing that toxins such as persistent organic pollutants such as DDT, PCBs, and dioxins are driving up our insulin levels. We're seeing some of the fittest people in the world, like the Navy SEALs, with hyperinsulinemia due to increased levels of toxins such as Agent Orange. We all carry toxic burdens. Babies are born with over 200 toxins in their bodies, and we're being exposed to more toxins in 1 month than what our grandparents were exposed to in their lifetime. If we were food, we'd be considered unsafe to eat. BPA, which is found in plastics, increases diabetes. Arsenic increases diabetes. Heavy metals, especially mercury and cadmium, will increase risk for hypertension and other vascular diseases. Increased levels of lead increase your risk for stroke by 151%, and 39% of us have it. Okay? So I had a patient a few years back that couldn't regulate their high blood pressure, and they were on 3 medications. So they came to me, and we took a really good history, and we kind of determined that the hypertension could be due to heavy metal toxins. So we basically because the man plow, he was a welder, and he did a lot of grinding of plows, and then would weld the plows, and then he'd use this paint, and so over the years this accumulated in his body. And so we did this test, and sure enough, he came back as being high in cadmium. And cadmium will cause high blood pressure, hypertension. So we put him on a chelating agent to remove these heavy metals, and within a couple months, his blood pressure just started to really come down nicely into a nice area. So that's one of the things that I just like to share with you is how we can look at these things. Now, he'd been on medication for many years, and was on a 3rd one. So that's pretty serious, but see, once again, we're getting into the fact that when you get diagnosed with a named disease, you get a pill. But in functional medicine, my work began once we found out he had hypertension. It's like, okay, so why do you have hypertension? Is it due to one of these factors, insulin resistance? Is it due to toxins? Is it due to hormonal imbalances? Is it due to, kidney? So what is causing that? All right. So that's kind of what we do in functional medicine. Okay, so inflammation. So inflammation is linked to all chronic diseases. Inflammation affects the mitochondria of the cell and reduces the number of mitochondria, which, if you remember, the mitochondria inside the cell, the powerhouse, it reduces the number. So that's going to be pretty important. And this will eventually lead to insulin resistance because it's going to cause a backflow. So if you can't get glucose in because there's no mitochondria, then that means that eventually you have more glucose in your blood, which is going to affect the pancreas to secrete more insulin. So this becomes a vicious cycle, and a very serious vicious cycle. So without mitochondria, you can't make energy. Without energy, you can't turn your food into energy. You can't detox your body, and you will not make hormones or neurotransmitters. So there's so much more I could say about inflammation, but that's a whole presentation on its own. But I would like you to understand just a little bit more about inflammation. So we'll talk about that. So you have two types of inflammation. You have acute and chronic. Now, acute inflammation is really important. We need this to destroy what has caused a trauma to the body or something that has entered the body. That's what acute inflammation is for. So it's needed to heal the body. But for some reason, occasionally this inflammation will persist, and it's due to what we're actually doing to our body. So things like bad diets, toxins, and all the things that we talked about today can lead to chronic inflammation. And so this is destructive and leads to the chronic degenerative diseases that we see today. Then over here on the other side, we can actually see some of the things that show an association between inflammation, such as viruses, gut microbiota, leaky gut, diet, stress, vitamin D deficiency, obesity, and environmental toxins. Now, we want to talk about visceral versus subcutaneous fat. And there is a big difference. So I'll show you over here. So you can see this man here, the outside here, this is the subcutaneous fat, okay? And this is the visceral fat. Now, metabolic syndrome is really driven by angry fat, also known as organ fat, or also known as visceral fat. This is not the same as the storage fat or the subcutaneous fat that we just showed you over here, okay? So there's a big difference. Visceral fat is actually a dynamic organ. It's actually anabolic. So like testosterone will build muscle, insulin builds this visceral fat, okay? Visceral fat becomes hungry fat. If your food causes you to release a lot of insulin, like high glycemic or inflammatory, your fat will actually become hungry, and then you'll become hungry yourself. Remember, fat has those GLUT4 receptors on it. So when you're active, the GLUT4 receptor, or when you activate, when you activate the GLUT4 receptor on the fat cell, glucose now enters into the fat cell, okay? So here, I just want you to look at what happens with visceral adipose. It's actually like an endocrine organ. And what that means is that it actually produces inflammatory mediators, so chemicals. It actually can produce its own hormones. And when you really think about this, this is crazy because your fat, this is known as VAT, so visceral adipose tissue, can actually cause hypertension, type 2 diabetes, cancer, atherosclerosis, and it can keep you inflamed. And this is very serious because you now have an organ that is actually causing disease in your body. And just imagine this, the disease, okay, or a disease causing organ that you created. So your lifestyle created this type of fat that is actually causing a disease. That's insane, okay? So how do you know if you have VAT or visceral adipose tissue? If you carry the majority of your weight above your waist, that is a good indicator. But you can have visceral adipose tissue and still be slim, and that's called skinny fat, okay? And this is always good to a good reason to get checked, just so you can make sure that you don't have a skinny fat problem, okay? So it's visceral fat. It's not subcutaneous fat. This is visceral fat, organ fat, okay? So here's a study that shows what we're talking about. So metabolically, healthy obese individuals had a higher risk of coronary heart disease, cerebrovascular disease, and heart failure than normal weight metabolically healthy individuals. Even individuals who are normal weight can have metabolic abnormalities and similar risks for cardiovascular disease. So once again, what I'm getting at here is getting tested is very important, because we can't tell just by looking at somebody if they have metabolic syndrome. I mean, it's a risk factor, but it doesn't mean they do. They still have a higher risk for all these diseases. Or on the other hand, if you're skinny, it doesn't mean you don't have risk factors for disease, because you can still have risk factors. You can have high glucose and high insulin. You can have high lipids, cholesterol, triglycerides, and those things. And those are all going to be risk factors for heart disease. Okay? So don't assume that you're healthy because you're skinny. Okay? And here's something else I want to show you, that even though when we do blood tests, sometimes some blood test comes back, because every once in a while I like to just as a guest try to see or think to myself, okay, that person's blood work is going to come back looking like this. Sometimes I have some overweight patients that their blood work comes back and they don't have their blood sugar is perfect, their cholesterol is perfect, and you're going, oh my goodness, like how could that be? And then I have a skinny person comes in and they're just off the chart, messed up. And so it's one of those things that you don't want to guess, you want to get tested. But what I want to show you here is how even though you have a high BMI, it's above 30, you can have no high cholesterol, no hypertension, no type 2 diabetes, but you can still have a risk factor for cardiovascular disease, because being metabolically healthy but obese means that you could still have a 49% risk factor for coronary heart disease. You can have a 7% increased risk factor for cerebrovascular disease, and you can have a 96% risk factor for heart failure. So don't assume you're healthy, just get checked. It makes it simple, okay? So I think we spent enough time on cardiometabolic syndrome, right? So, and you may be thinking, maybe I have it, or you should be thinking you definitely don't want this. So I think what I'll do is I'll spend the rest of the time talking about how to treat this and prevent it, okay? So your health is like a combination lock. You need the right number in the right order, okay? Does that make sense? And so there's 5 things that you really need to be doing, and they need to be in the right order, okay? And that's what we're going to talk about. So biotransformation detoxification, that's the first thing. So this is where your body breaks down the toxins and eliminates them, right? So this will also help regulate your hormones. Now, the problem here is that most of the time we don't have the nutrients to support this pathway. Okay, like we said, you need to have energy to have this. You need to have the proper nutrients for all of these things to be broken down. So that's one of the things that we want to make sure is happening, is to get you the proper nutrients to support the biotransformation detoxification system, so that you can get these toxins out of the body. Okay, and this is also where we really begin to look at healing your gut and healing your liver. And there's reasons why we do this first, and because we want to basically reduce anything that could be creating decreased energy, inflammation, hormonal imbalances, just to name a few. As you saw earlier, how pesticides can affect you. Okay, so pesticides can affect the energy transport systems, and so we need to make sure that there's nothing that could be affecting you to have this all this pathway working. So we also want to start working on healing your gut and your liver, and doing a deep cellular cleanse for the next step. So each thing's a step-by-step thing, and that's nutrition and diet. So the second thing we look at is we want you to be on a low glycemic, anti-inflammatory, and a diet specifically designed for you. And it should be based from your blood chemistry, your genetics, your metabolism, metabolic function, mineral deficiencies, and basically be individualized. And what I mean by that is no two people's diets should be the same. So your chemistry is different than my chemistry, so your nutritional needs are going to be different than mine, right? And we offer that specific diet, and it's basically called a healthy and active diet, okay? Movement and exercise. So as you've all seen, it's placed here for many reasons. Also, one of the first things is because we want to make sure that you're getting the proper fuel to support your exercise regimen. And as you've seen earlier in the presentation, many things can affect the energy pathways, like toxins, inflammation, and you saw how they can affect the GLUT4 receptors, right? So you remember the sedentary lifestyle will shut down or inactivate the GLUT4 receptor on muscles, right? So it's going to prevent the glucose from entering into muscles. However, that activates the sedentary lifestyle, activates the GLUT4 receptor on the fat cells, which is what would happen. So then glucose is going to enter the fat cell and cause you to have more fat. So basically, we just want to remove some factors that could be preventing you from benefiting from exercise, okay? Exercise also increases the number of mitochondria, so that's really, really important. And exercise can also help with balancing your hormones, which is very important, and which is the next step in your foundation for health, okay? So balancing your hormones is really important because your hormones are the communication system of the body. And this is how your body speaks to itself, right? And as you have seen, it's very important in regulating all bodily functions and controlling inflammation. And the reason why it's fourth is because by the time we get to testing your hormones, we want to have removed some of the causative factors such as toxins, foods, and sedentary lifestyle. So by the time we get here to get this actually tested, we get a much truer reading, and because we've eliminated any of those potential factors that could be affecting your hormones, and that's really important. So when I go to treat your hormones, I have removed all of those things that could be affecting. Now I'm going to be able to treat it much better and be more effective at treating that, and people really do appreciate the how efficient this system really is. The fifth thing we have to look at is balancing your nervous system. Because it's also part of the communication system. This is one of the big parts of how your body speaks. And so there's two parts to your nervous system. There's sympathetic and parasympathetic, and the sympathetic is the fight flight. So that's like, as if a bear is chasing you, and your parasympathetic is like rest and digest. So like you at home relaxing and basically digesting your food. Now today's environment is so stressful that we all have this chronic stress, which causes us to release hormones and neurochemicals that keep our bodies reacting as if we're under a lot of stress. And one of the things that this does is that when your body thinks it's under stress, it stimulates the liver to continuously release glucose, which then stimulates the pancreas to release insulin, which was going to keep us inflamed and fat. Okay? And so that's not what we want. So this is going to be very harmful to our health. All right? So I could spend a lot more time explaining all this to you because this is what I really have a passion for, is understanding the human body. But all you're really going to get is more information that you're going to forget in a day or so, right? So let me ask you, would it be better if you were shown how to apply this information so that you knew how to apply it for the rest of your life, right? I mean, that's good because that's what I want to offer you. I want to offer you the opportunity to work with me and build a healthy foundation for the rest of your life. Okay, not short term, but for the rest of your life. So does everything I talked about in this presentation make sense to you? If it did, good, because that's what I want. If not, then please ask some questions, email us, call us, whatever. And I would like to offer you the opportunity to work with me. So this way we can sit down, find out what's going on with your health, kind of where you're at, and then come up with a health plan. Okay? So if you'd like to work with me, then all you have to do is book a consultation. So you can call our office at 1705-647-6070, book a consultation, or there's also a place after this presentation where you can book a consultation at that time. Now this consultation is specifically for you. Okay? Now I do charge for these consultations, but I've reduced my fee because you're watching this video. So the cost of the consultation is $57. Now that doesn't really cover my time. Honestly, it doesn't, but I've reduced the fee because I know that if you've watched this far, you want to learn more. You want to find out what else you can do. So you're probably saying though, well, if that $57 doesn't cover your time, why charge it at all? It's called having skin in the game. And I need to know that you're committed to your health and that you're serious. So if you're willing to pay the $57, then I know you're going to become an active participant in your health, and then we have a partnership. Okay? And if we're doing a consult, if it's over the phone, that's going to be harder to do this. But if you're coming in to see me, we just ask that you bring your spouse. We're going to be covering a lot of information, just like we did today. And do you think you could relay all this information that you received tonight? No, you couldn't. Right? So they should really be at the consult because it's going to be the same thing. We're going to be going over a lot of information at the consult. And so, if they're not there to help you make a decision, then you're going to have to go home and relay this. They're not going to get all that information. So it's important that they're there. Now, if your spouse wants to see me for an appointment, hey, that's cool. Then we only charge $37. I want to make this affordable, all right? But if they don't want to see me, then there's no charge, but they still should come to the consult, okay? So in your opinion, how many of you have a health plan that takes into account everything we just talked about, right? Well then, and if you don't have that health plan, I hope you take the opportunity to work with me and move forward with your health, because I occasionally see people that don't, okay, move forward with their health, and only later to see that their health has declined. And I don't want that for anybody, because we all have a choice. So here's another good quote. We do not get unlimited chances to have the things we want. Nothing is worse than missing an opportunity that could have changed our life. And this is really one of those opportunities. This is a life-changing opportunity, okay? So I want you to think, that I don't want you to be like this. So it's like you're in a rowboat sometimes, and you're mindlessly floating down the river. And then all of a sudden you look up and you're 5 feet away from going over Niagara Falls. And you say, oh shit. Now you have to paddle hard and fast to get back. But the problem is, a lot of us don't have the strength to do this, right? So this is what I'm talking about. If we wait for the perfect time to take care of our health, or if we wait till we have a disease, we're going to have this moment where it's like, oh shit, I should have done something earlier. Okay? Because we're mindlessly floating down this river, and we're expecting something from our health. And there's been so many opportunities where you could have docked off and done something to improve your health, but we didn't. We wait and we wait until we're 5 feet away, or it's too late. And I don't want that for people. And I often see people, and I hear of patients that have done this, and they'll say, hey, have you heard of such stuff? They're not really good. They got cancer, and it's here, it's there, or they had a heart attack. When I know years ago that we talked to them, we could have done something, but they chose not to do that. Don't be that person. Book the consult, find out where you are with your health. Okay. So I want to thank you for watching this. I hope you got some very valuable information. And just one last thing. In the end, we only regret the chances we didn't take. And once again, it's lifestyle related stuff. And I know how important it is for people to get checked early. Don't wait. Okay. So if you're watching this, and you've watched it this far, I know you're serious about your health. So all we ask is that you book a consult with me. Let's check some things out, see where you're at. If there's some changes that need to be made, let's make those changes. And if there isn't, hey, that's absolutely great. And I'm really happy for you. Continue doing what you're doing, but let's get that checked. All right. So once again, thanks for watching this. I hope you got some good information. I enjoyed doing this. I enjoy treating people and helping people, seeing people change their health. All right. So have yourself a great day. Talk to you later.